Hi, I'm Dr. Dai Chung, Chief Medical Officer of the Joint Pediatric Enterprise between UT Southwestern and Children's Health. In these videos, I'll sit down with various physicians to shine a light on the clinical excellence, innovation, and medical advancements that are happening across our enterprise. Tell us about your program.
I'm one of the co-leaders of the Heart Center. We are among the largest programs in the country by volume of work that we do, by catchment area that we cover. And we pride ourselves in pretty much taking care of the entire waterfront of cardiac procedures and conditions and needs that any child or adult even with congenital heart disease might have. In the last 10 or 15 years in medicine, the term multidisciplinary has become very common. A lot of medical conditions, for children and adults, require input of multiple specialists. But to have that input be coordinated and seamless and synergistic requires a fair amount of organization. And one of the things that attracted me to congenital cardiac care originally was that this has been a part of the specialty and of the profession really since its origins in the 1930s. I think we have about 450 people in one form or another who would identify themselves as being part of the Heart Center, if not exclusively, then for a significant component of their professional activity. This hospital and our Heart Center, for that matter, began in response to a local need. There are a lot of people in Dallas who have children who have congenital heart conditions, and there's a need for those children to be cared for. But because all things in Texas are big, there's a big need for that. And so we have a relatively high volume program. What that gives us, not uniquely, but there are only a few other places in the country that have the volume that we have, it gives us the opportunity to develop an experience and an expertise that positions us to improve the overall state of the art. The heart failure team has become increasingly known as expert in managing a variety of very unusual and exotic causes of heart failure. So this is an area of really nearly spectacular growth over the last several years. So somebody who's thinking about why should we come here, we have an incredible place to be taken care of.